were asked to do a presentation on mental health and sickle cell disease. And so I'm thankful to be joined by Adrienne Shapiro of Access Advocacy. So I'm going to just forward. And then when it comes, you guys know us, we're family. And so you have a question, raise your hand so I can see, because when you're in this mode, can't always see the chat if you have any questions. So as you know, you've been here before, and there's always two parts. So the first part, then a break, and then the second part. So our first part will be brief intros. I'll share the story of Bobby. Adrienne will speak, then I will speak, then we'll have a break. Then, of course, I'm going to give you the facts about mental health and sickle cell disease. We're going to summarize those points, have an open discussion, and how you can contact us. All righty, so Adrienne, you want to introduce yourself?
Hi, so I'm Adrienne Shapiro of Access Advocacy, known as mostly in the community as one of the mama bears. And I am fifth generation of mothers in my family to have a child with sickle cell disease. And I really, how can I say that? I really used to tell people in my family, the other cousins and everything, that I felt like of all of us cousins, I was probably the most well-suited to have this role. I was one of the ones who's lucky, at least we thought I was lucky that I didn't have the trait, and so that I wasn't going to be that mother. But as God had different plans, I am that mother. And so I want to say Happy Mother's Day to all the I always say born and found mothers, of which I have several in my life, and I know many of us have. And I think that's one of the lessons that Sickle Life has taught me, and that is that the mother heart is the mother heart. And you find it sometimes in the most unexpected places. And you also can find it missing in those expected places. So again, it has been another, as they say, we are made in his eyes. We have that part of God in us that allows us to expand and love without limits.
Thanks, Adrienne. And I'll introduce myself. I'm Dr. Carolyn Rowley, Executive Director and Founder at Cayenne Wellness Center. I'm also an adult person with sickle cell disease, native of California. And it's interesting that I do consider it a blessing. My life is a blessing, managing this life with sickle cell disease. And I'm doing exactly what I'm supposed to do. And I thoroughly enjoy hearing from, working with, serving the sickle cell community and everyone that I've met in my path, everyone, the families, the warriors who are with us, those who are no longer, the medical staff, the nurses, the doctors, other CBOs, people who, because our community is very special. It's not like any other chronic illness type of organization or people. And so I think that we're all blessed. And so so I thank you for I'm blessed for this, for being in this role, and I thank you for the opportunity to share. So with that, let's go to the next slide. So I'm sure that you all have stories. I like to always share a story. I think for me, it means that people that we've encountered, they remain with us. And I think that the story of Bobby is most fitting for the topic. So with Bobby, he was literally my first patient I still remember the phone call when I finished school, moved back to California, and I'm in Glendale, and Bobby was at that time in Upland. That's a long drive. That's at least an hour and some. Anyway, 18 years old, in the hospital, and had been in for a little bit and was not still in so much pain. He just didn't want to leave the hospital. And unfortunately, Bobby had decided that he wanted to die. So they moved him to a convalescent hospital, and they called me, and they wanted someone who was a psychologist that could hopefully convince him that life was worth living. So, wow, what a challenge. One of my first patients. And so I remember being so gung-ho, eager. I had that long drive to think about what I would do. And I introduced myself, and he was very pleasant and that didn't turn me away. And so initially it was, again, to let's turn him around um, and have him realize that life is worth living. And so we connected, we shared, and at the end he said, "So Dr. Rowley, could you guarantee that if I remained here, that I would no longer be called outside of my name, sickler, which is very derogatory, frequent flyer and other things. Could you guarantee that?" And I said, what we could do, I can make sure that you let me know and I can advocate for you. I'll come up and I'll drive there and speak to those to educate them. And then he said, "So, but can you guarantee that when I come in that I'll be believed, that I have pain, that I'm at a 10 and that I need pain relief? Can you guarantee that I'm going to get relief and I'm going to get what I need?" And again, I said, "Well, again, you let me know and I'll drive up and educate and share with them. I'll be your advocate." And so, and then he said, "So can you guarantee that I won't have to wait and again, that I'll be believed?" So as a result of I couldn't guarantee, and this was, goodness, 1997, I believe. And unfortunately, everyone, this is still going on today, if not even more so. So ultimately, what wound up happening is I had to switch my intention. My intention was always to understand, to love, and to support. But now it was more of just to be a friend and to just be there, because he had decided that he was going to allow his body to atrophy. And at 18 years old, that he had had enough. And so the reason why I share this story is I think is how sad that at 18, and many of you guys who were on the call are well over 18, well over 40, probably well over 50. So could you have imagined that your life would have stopped there? But he no longer wanted to manage all of that. And so I think that's why it's always fitting to share that for some, it is exceptionally hard, and how mental health support is really important. Thank you. Adrian? You are muted.
When I first heard the story, I thought, wow, that this story was the exception, right? That people living with sickle cell were like the people that in my family, which was my brother, who was happy and sweet and surrounded and loved, right? And I thought, I really thought that being tired by 18 was really the exception. But in this advocacy world, I learned differently. I learned that I had not blinders, but that I had such a non-typical experience in living with sickle cell disease, and that my mother was so devoted to my brother, and our family was so well, I wouldn't say we were well adjusted, but we had a great rhythm and acceptance coming from my mom's heart about sickle cell. And so when my daughter was diagnosed, it was like, it was a shift in my head. I always say your life changes when you get that letter. And it goes from the lens of how am I raising, a healthy, happy child, what school, what things are they gonna like, those kind of things, to health and safety first. And the thing that I came to realize, that if you're looking at something to health and safety, like first, live or die first, that already puts you kind of in that line of high stress. Because most people just get up and, again, what are we going to eat? How I'm going to go to work? What do I have to do? And we have all those things, but the first thing that really is, how am I keeping my loved one alive? And if you are the person with sickle cell, it is, how am I going to be alive, or what am I going to need to do to help me today? And when I was talking to Carolyn about this last night, I tend to kind of gloss over what made me not resilient, but as resourceful. And I saw my first psychologist at 19 years old. And I realized last night, that's just not normal. That's not normal in your culture, that our culture, that's just not normal. But I was 19 when I realized that for some reason, I needed help, and I needed a place to tell my story and look at my life without judgment. And so I guess that really, I want to say, if you go away from this talk with anything, I want you to understand that taking your own mental health and making that be your oxygen mask is really the way that you can do something for yourself. It's not an end all do all, but it is one of those things that when you look back, because I never expected to live this long. Everybody tells you when you have a child with sickle, even though nobody ever said it directly, and my mom was like, Will, my brother was going to live, and my brother lived at a time when people with sickle cell didn't live, and he had a healthy life until he was 51 years old, right? And he was and held so closely. But for me, the thought of losing my child before I did, and that was not a natural state. But if that happened, my plan had been, if she goes, I'm going. We're just gonna go together. Now, when we started to talk about this, I wasn't prepared to share that, but I want to tell you how this advocacy work came about. I was very much involved in my child's life and knowing what I needed to do. And so I didn't have that learning curve of understanding temperature and water and the need for doctor visits. And I didn't have any of that because I had grown up having that with my brother. I went on about my life. I had amazing relationships with Marissa's doctors. And I had one of the best doctors ever, Dr. Edmonds, and he took my questions and I had parity. And when I look back at that, I realized that that was unusual too, right? I mean, every place else I went, they were like, here's this little girl with this child, but he was like, you're the mom, ask all the questions. And he answered them for me. And so I had that gift. It wasn't until my first awareness that things were different for other people was when Marissa was in first grade. And it was her first chance at camp. And I didn't want her to go to camp, but her doctor was like, either she goes to camp and you better, or not. If she doesn't go, you better hope she doesn't get sick because all of us docs and nurses are going to be at camp. And so I let her go. And even for that was kind of this, in my life, as all things, it was a big deal. My friend came, he bought his truck, his fire truck, and the firemen let the kids go on it. And it was, of course, a big deal because, you know, Marissa was going off to camp and she had sickle cell. And we looked down the hall of the trail, the railroad station, and we saw a friend, a classmate of Marissa's. And we saw her mom and we thought, oh, I wonder where they're going. And it wasn't until they started calling people to get organized to go to camp that we realized that this classmate of hers was going to sickle cell camp. Now, the interesting thing was that none of us knew she had sickle cell. Everybody in the school knew Marissa had sickle cell, from the coaches, the nurses, the kids. Marissa had notes. I had come in and talked to them about what she needed to do. And I knew this mother who was involved in her child's education had never, ever spoken to me about sickle cell. And it was a shock. And I thought, that's really odd. And then I thought, that's really dangerous, because what if she gets really sick and nobody knows? And I guess I kind of thought that, all right, you know, this mom just was private and didn't share things. So I started being very close to the child and taking her because I was happy to take her because I knew sickle cell and I felt comfortable doing it. And I remember being on a trip. We had at that point sickle and hemophilia and cystic fibrosis. The kids would always like be together. And we were out on a Christmas trip where they took kids out on the boat, and you could see the holiday lights. And I remember looking at this child, and this child was in such emotional pain. I was all prepared to and understood physical pain and the signs, but the emotional pain that this child was in. And so I just sort of remember that scene. And as she got older, she remained in pain emotionally. And there was very little we could do. We tried, right, very much to sort of engage her and keep her close to our hearts. But she would tell me how tired she was. Now you have a 7, 8, 9, 10-year-old kid telling you how tired they are. I went out to learn, you know, why was she so tired, right? It had to be a medical reason for it. And so she was SC, and I was like, okay, what does that mean? How does that affect her? What do we need to do? Looking for a medical reason for it. And it turned out that it was really more her sense of isolation and not being alone. She was an only child. And around 11 years of age, 12 years of age, her mom became unwell. So not only was she unwell, her mom was unwell, and then she lost her father. So we had already gone through that too. Marissa's lost her father at the age of 8. So again, I'm thinking God has me in the right place to help this child. We formed a group, a small group, a support group for just families, thinking we could all get together and they would meet at my house. And we would, if a family needed money for their lights or medicine or whatever, we would raise money by baking cakes and doing things and just building that community for people that didn't have what I had. And this went on. I always say that was my first axis. And so we supported each other. We did education. At that time, there wasn't family support groups for people with sickle, so we had our own. And then this child, you know, sometimes would just be the two of us. I would be with her, and she would always say to me, I'm really tired. And when she was 16 or so, I kind of dawned on me that she had always been tired. And so it wasn't medical. And I started saying, well, you know, there are people you can talk to. There's places you can go, doing all these things to try to help her along and help her understand how the disease was making her tired. You know, the red blood cells, and then by 16, I was like, had started putting it together. It was the isolation, it was the disappointment, it was the feeling of responsibility for not only her life, her mom's life, everything that this child was carrying. So we lost this child. This child, and I don't think I've ever shared this story, this child, because of her isolation and lack of support, this child told me, she sat me down and she told me, she said, you know, I'm really done with all of this. And I kept saying, just wait till you get 18. When you're 18, for some reason, 18 was the magic. When you're 18, you're going to be in charge of everything. You're going off to college. You're going to do all these things. Just wait, just wait, just wait. And she's told me that she wasn't going to wait and she was done. And she meant it. And when this child committed suicide, she was really done. I at that point could not grasp why I didn't see it. How come I didn't understand it? What could we have done? And I really think, looking back at it now, that's the driving force in me of thinking, what can we do? So I never ever wanted that to happen to anybody else again. I never wanted anybody to feel alone. And we spent with Marissa many years in the cancer center. And at the cancer center, they had everything, right? They had therapists, they had cooking groups, they had sibling groups. When the people would come in for their infusions, they would have aides with them. They would have, some of them had, aides that the family paid for. They always had somebody with them. There was journaling. There were all these types of support for them. And I just would sit there and read the books on cancer because that's what they had. And it talked about how the outcome for the cancer survivors, what was the major thing that they had to guarantee a better outcome. And it was, they had support. They had support at home. They had support at the point of care. They had layers of support. They had social services. And if you had all of that, you would have a positive outcome. And so when I met a grown-up young lady who didn't have those things, I was in shock at her condition. And I really thought she was rare, right? And come to find out from Dr. Carolyn and Pat Corley that that was not true, that my life was the rare life. My life was the exception. All those things I had growing up, all those things I put in place, the fact that Marissa had had only 3 hematologists as a child and 1 as an adult, all of that was really rare. And I thought, well, how do we get for us what we need? And so that's how we ended up creating the advocacy program. It was based on life experience and research on what made things work for you to have a good recovery. I'm going to turn it over to Carolyn. Dr. Carolyn, sorry.
So I want to thank you, Adrienne. And I think that's the reason why we put connection, support. I wanted to also acknowledge Stephanie.
Stephanie.
So Stephanie, thank you for mentioning that because
Let's see this.
I'm glad that I'm sorry that you experienced that, but this what's happening is not rare. That what Adrienne experienced with the young lady, what you experienced, and my experience with Bobby. And so to me, this is a state of emergency and we have to do something. So this talk is right on time, mental health. Okay, I'm going to take my turn and talk about foundation. So in terms of mental health, for this particular hour, we're going to just talk about the foundation of building mental health and then talk to you about the facts, mental health and sickle cell disease. With myself being a psychologist and being very holistic in my practice, one of the things that I've always incorporated that you'll probably be hearing next week as well during our Cayenne's mental health mini seminar, is based upon Alfred Adler's life task. He was a student of Freud, broke away, as many of them did, and came up with what's called individual psychology. So if you've ever heard of the birth order, if you've heard of group, if you've heard of inferiority superiority complex, Alfred Adler developed that. But he also talked about how to live whole. And it's based upon these different life tasks: work, social, love, self-acceptance, spirituality. I'm only going to mention them briefly. So when I would see someone, I would ask in terms of what's going on in terms of work. Now, work has to do with not just that you're employed, but also you might be in school. how is that going? If you're employed, are you doing what you want to do? Are you satisfied? Are you unhappy? Are you anxious? Same thing for school. How well are you doing? Are you needing assistance, or are you going down have you chosen the right major? You may need to change the major. So if anything is off, that needs to be dealt with. And you'd be surprised how many people just kind of keep on going and not pay attention. Next is social. Social has to do with family and friends. Believe me, there's a lot of family dynamics out there, whether you have sickle cell disease or not. And so can you imagine if you have family dynamics that are not supportive? The story that Adrian just shared, where both the daughter and the mom were hurting. And so social has to do with family and friends. So how are your friendships? Do you find them to be supportive? Are they dismissive? Or are you isolated? Do you isolate yourself? I remember someone in our support group years ago, young lady, 18, she had never told her friends that she had sickle cell disease. So in the group, we asked her, so what happens when you're in the hospital and you're gone for at least 5, 7 days or what have you? She said, I just told them that I had a bad cold or the flu. So we challenged her on that. And her fear was that her friends would look at her different. They would treat her differently. And so there was not that trust. Again, that's very pivotal in terms of your mental health. If you have these relationships or how these relationships are, then love. So according to Carl Rogers, love and Adler, it's the hardest, it's one of the most challenging of all these different life tasks. Not too many people actually get it right on point. Unfortunately, that's why we have so much divorce, right? But love is important. And so that's the hardest one. It's the most challenging one. That doesn't mean it's impossible. So in terms of looking at your relationships, self-acceptance, I think that's self-explanatory in terms of if you're able to accept that which has been given to you, work with that and really soar. You'd be surprised how many people are unable to accept the fact that it is what it is. You have sickle cell disease. And so what are you going to do about that? It doesn't have to define you and limit you. So self-acceptance is important. And then finally, he talks about spirituality. And he doesn't say that you have to be a Christian. He just believes that everybody should have a higher power in their life. So these areas are very important. And if at least just one of them is off balance, it needs to be dealt with. Surprisingly, unfortunately, for many people, they can actually have some issues or challenges in every area. So you can imagine. So that's the foundation in terms of looking at us, each person holistically. How is it going in their work, social love, self-acceptance, spirituality? Now, I'm going to add to that. So as you keep that in mind, everyone, and I think it's really good for each one of us to just quarterly, twice a year, look at ourselves that way and see if everything is kind of lining up. In addition, I like to add some things that I think are important in terms of movement. You got to move your body. You have to move your body. It doesn't matter whether you've had hip replacement, shoulder replacement, even if you have a leg ulcer, you can move the upper body. You have to move your body. There are chair exercises. So, your body can atrophy and that doesn't feel good. So if you're already not feeling good mentally and you're not moving your body, you're not going to feel good physically either. Got to figure it out. For myself, I do Pilates and gyrotonic and I walk and I love it. I like to be able to walk more. A lot of that just has to do with being busy, but movement, I do know the power of movement. and how actually this is life-changing, being able to move your body. And you can make it fun. I know that some people are limited, so you may not be able to do these extraneous hikes, but you can go to the beach and walk along on the sand, do hikes so that you can get into nature, walk around the track, um, anything that you can do to move your body, you'll feel better. Nutrition, I think everyone knows that I am plant-based. Nutrition is very important. I have a degree in that as well, and even wrote a book called 344. So nutrition and sickle cell disease, key, because unfortunately we're born with all these different deficiencies in magnesium and phosphorus, um, and vitamin B12, vitamin D and C. So literally, it's really important what you put in your body. I'm not saying that you need to be vegetarian or vegan or plant-based. What I am saying is that it's important that you um, take in whole foods, foods that have not been processed. These days, I don't know if you guys have heard, but there's now a book called Ultra Processed People. Oh my gosh. So being ultra processed, and they're saying pretty much about 85% to 90% of what the average person eats is ultra processed. So if you're eating bread and it's not like homemade, then that's ultra processed, or margarine, ultra processed. And so it started off with having some ingredients that were recognizable, but now they make it so that it's not nutrient dense. You want to eat more of it. So it does lead to gaining weight and obesity, and it leads to diseases. So that's a whole nother topic on ultra processed food. But with nutrition, if you want to feel good, put good things in your body, okay? Um, in terms of just fresh fruit, fresh vegetables, um, beans, and if you eat meat, then make sure that it's grain or grass-fed. So I think if you can just look at being more eating whole foods, hydration. I think we all know that's so important, but I think what we don't know is that I think even when we think that we're hydrating, we probably need to do more of that. And so hydrating is so important. And I know they say drink whatever you weigh, drink half of that in ounces. That's a good start. And primarily, and I don't really, it could be 8 to 10 glasses. My thought is just continue to drink. Drink if you can remember, do every 2 hours. Your urine should be clear. And I know that people with sickle cell disease, they tend to concentrate their urine. And so I tend to look at that, but I'm very conscious of hydration, breathing. So Kimball started us off with just being mindful of our breathing. I would ask that you be mindful throughout the day, particularly when you're transitioning from one thing to another. Just go outside because you've been inside for a little bit and take some deep breaths, take in the vitamin D, the sun, and then go back. You know what? That can only take 3 to 5 minutes just to be able to be present before you do the next thing. And then last, live with joy. And so this mental health is really real living with sickle cell disease, and it starts really early. And it's unfortunate that many parents may not be aware, and or even healthcare providers. And so intentionally in high school, um, there was a defining moment in my life where I spoke with the Lord that if he saw fit to keep me alive, then I would have to be able to live with joy and not despair or depression. Because with sickle cell, it can be somewhat of a yo-yo, meaning you're well you're doing good, moving about, and then you're in the hospital and you're in pain and you're having to convince folks. So now there's that downward spiral and then there's that upward spiral. And I didn't like how that made me feel at all. And I too was ready to say, take me. But I had this defining moment that I'll never forget, that if you allow me to live, then I need to live with joy, so that no matter if I have pain, I will still be joyful. And so obviously I'm still here, everybody. And so my intention is to live with joy. And I want, and Adrienne, just feel free to chime in at this point as well. You're muted.
Sorry, I have to mute because of the dogs. So, it is so important that we look at our lives at and we honor what it is we've gained living with this disease in our lives. You know, there's always this, the businesses, there's a profit and loss statement, right? And so even I think with your life, you kind of look at that. And for me, when I look at this list, for example, how I see so many of the warriors doing these things, right? And what we'd like for is, right, all of us to do all of these things. So I think we should start sharing how they're doing it. For example, the movement thing. So I have one warrior who would be in her bed and she would be in pain, right? And when you get in a lot of pain, of course, you don't want to move. I've seen it where it's hard for you to even breathe, right? And so the joke was, it was hard, but she could still bat her eyelashes. So it is the finding, and she would like one of her favorite characters was Betty Boo. And so she would do that. And then we would just start laughing because it's horrible to think that you're in that much pain, right? But you can bat your eyes. So it's finding that sort of point of what can you do when you are in your worst space, and then moving out from that. What can I do when I'm feeling good, right? Can I make it up and down the stairs? Can I do movement in chair dancing? So thinking of that as opposed to thinking of what you're seeing on TV or Facebook. The nutrition, I have a different take on the nutrition and why we kind of eat the way we do. Our lives are unpredictable. And so a lot of times we're grabbing food, right? And on the go. And also when you're in the hospital as a kid, they want to be nice to you and everything. They give you a lot of cake or cookies or 3 hamburgers or whatever. And the hospitals are really not set up for good nutrition. So understanding that, when being mindful of, as Dr. Carolyn said, having like an apple, first maybe starting off just saying, I'm not going to have the cake. I'm going to ask for fresh fruit. I'm not going to have, even though your body will be craving sometimes that 7-Up or whatever tasty thing might come, being mindful and saying, okay, well, maybe I'll only have one piece of cake, which is processed, and moving away from it. Hydration game is really interesting in that the way we're dealing with it is if I have one cup of tea, then I have 1 cup of water. If I have 1 cup of something, then I have 1 cup of water, and then move myself towards it. The breathing is the hardest part to me because I'm going to breathe whether I'm thinking about it or not. And so it is getting to the point where you really do have to train yourself to breathe. And one of the fun ways is, if like 5 minutes out of the day or whatever, is to actually put your hands on your diaphragm and actually see whether or not it's moving in and out. If it's not moving in and out, you're not deep breathing deeply. And I find a lot of us do have those moments. Some of you send out the funniest things in the most harshest of circumstances. And so I think taking that, finding that joy there when you are in the worst of the worst is a skill that you want to apply to when you're not in the worst of the worst, right? So we can find sense of humor. My craziest story is when I treated a doctor like he was a drug dealer and paid him cash money to do a treatment for my daughter. And that was crazy, right? And it makes me laugh. So I can still laugh when something's not that desperate. And I am so grateful when we have any moments together. And I think that under all circumstances, when we are gathering together, to be grateful.
Thank you.
Stephanie raised her hand. If we'll have
Oh, I
Stephanie
didn't see it.
and then Kristen as well raise their hand. So we'll go
I can't
Stephanie
see.
first and then Kristen real quick.
Right.
Looking for
Thank you. This isn't about specifically about movement, but it is about mindset. Um, I am the youngest in my family, and my sister was 22 years older than I am, but we were very much alike. And I don't remember us being taught this, but we never, we always felt that saying, why me? Why me? She had cancer 5 times. She never said, why me?
Mhm.
Saying, why me to us made it feel like we were in some way saying we have some special dispensation that we should be free from the hardships of life, which is obviously not true. So we look at it as I'm grateful to the fact that I'm on this planet, I have sickle cell, and yeah, that's hard, but think of the amazing people I've met. When my kids were little, I couldn't work, so I saw all my children take their first steps, do their first this, that, and the other. It didn't have to be video recorded because I was there. There have been so many super cool people that I have learned so much from. So I am grateful to the fact that I have sickle cell because of what sickle cell has brought to me. And I know Marissa and I always have a difference of opinion on family because in my generation I keep telling her that we specifically made the choice to once we turned 18, and we talked about this in the support group we had at UCLA. We made the choice at 18 to basically look at it like, okay, our parents have been there for us the whole time we've been doing this, and now it's their time to be able to do what they need to do and our time to step into what they've trained us to do. So no, you don't have to come to the hospital every time I go, as long as I can reach you by phone and you know where I'm, you know the teams that I have and they know you and they know that you will be there if I have to pick up this phone. You really don't want me to have to pick up this phone. We chose to do that. So I think sometimes people in medicine lump everybody's involvement or lack of involvement with family in one boat, and that's not always the case. I think we would do well to like further that conversation of why is it that you only call them and you don't call them in, but not to assume.
Thank you, Stephanie.
Yes.
And we have another
Yeah,
question?
and then Chris, you could go ahead.
Greetings, everybody. I wanted to just speak from someone who is a caregiver for a sickle cell warrior. So my perspective is not necessarily someone who has been dealing with it directly, but also like really dealing with it directly too, right? Because we feel a lot of that sensation, and it becomes very psychological. Seeing your child in a position where they need you, but you're kind of limited on like what you can do. Um, my first child, our son, he was diagnosed with sickle cell anemia, and for the first few years of his life, it was a very much an emotional roller coaster. Just seeing what some of the procedures were like. In the hospital, during the hospitalizations, from like them sticking tubes inside of his penis when he was like 2 years old, from them like strapping him down in a chair to extract his blood. And I was just thinking to myself, like, wow, they don't call them warriors for nothing, because the fact that somebody 2 years old has to go through or endure this type of um goodness. I mean, you can look at it like violence, or you can kind of look at it as care, but it's like to like wrestle a child down to stick a tube inside of his penis. The child is not understanding any of the things that you're trying to explain to him, or to take a child and strap a child down into a chair to stick a needle in his arm, and then the child sees the blood leaving your arm while they're also afraid of needles. It's just kind of like it brings in a whole psychological, you know, um, area of activity into it, where the child is looking towards the father and saying, like, I'm asking you to tell them to stop. Why are you not telling them to stop? So having those type of moments where it's just so much anxiety and so much stress in these situations, from a parent's point of view. You kind of develop this cognitive dissonance, like, okay, well, if the child is coming here to be helped, and then the child don't even want to come here no more because of the trauma that the child experienced in the beginning of what was supposed to be helpful. It kind of forced my wife and I to kind of shift the narrative to focus more so on like preventative, and using nutrition as a tool to prevent the crisis from happening altogether. So one of the things that we've been using um, a tree called moringa, and our child has been taking it every single day. And it has a lot of different anti-inflammatory properties inside of it, and it also has a molecule in it called isothiocyanate, which has been known to have an anti-sickling impact on the blood. And he's been taking it every day since he was about 5 years old. He's 10 years old now, and he hasn't had a crisis or a hospitalization behind sickle cell. And we owe a lot of it to plant-based nutrition, as well as hydration, focusing on his needs, but making sure that we're doing the things that we need to do as far as understanding the food as medicine. Because nutrition plays a huge part in crisis. And when we look at our community, it's not just the sickle cell community that's suffering from a lot of these different chronic diseases, but it's amplified in the sickle cell community, because this is a a fragment of our community that really needs to be eaten according to their DNA. And Dr. Fatima Muhammad, she did a lot of work around this concept of people, plant, and parasites, this coevolution between plants, and how sickle cell originally started off as a defense mechanism against malaria, and how the food actually allowed those blood cells to go into a sickle shape, and then also brought them back into a whole shape when the threat was no longer there. So also to be able to get information that is not necessarily discussed inside of these institutions, they don't go really deep into it, about some of the aspects of sickle cell that doesn't promote inferiority, right? Some of the aspects of sickle cell that can be encouraging and that can embody some type of or put us on a path for more knowledge of self. So I think as a parent, we have to be the not just a father, we have to be the herbalist and the doctor and the physical therapist and the massage therapist and all these different things. And I've noticed that there are ways to prevent the crisis from happening, but a lot of that is founded on what we put inside of our body, and also what type of environments that we put ourselves in, and the stress that comes from that environment. But out of those three things, the stress, the environment, and the food, I think that the food is one of the higher priorities, as far as preventing the sickling from taking place. So we've developed an organization, a community benefit organization, and we grow moringa throughout California. And so one of the things that we do is we offer moringa packages to members of the sickle cell community at no cost. And so we have a promo code that allows them to come to the webpage. And when they come, they're actually able to put their information in, and we'll mail them out a moringa package at no cost, just as a way that we can help resolve and support some of our community's most vulnerable members as well. And in regards to breathing and movement, we also offer yoga classes as well, comedic yoga classes, as a way that we can help bring in harmony to the aspect of movement and breathing. And a lot of times we've been separated from our intuition in this society. So it's also a way that we can bring ourselves back home.
So Chris,
So
where do you
Chris, yeah, because of time, sorry to need to cut you off so that Dr. Carolyn.
I'm going back on mute.
Oh, no, not yet. Where do you reside? Are you in California?
Yeah, I'm in Northern California.
Northern California. I thank you. And so I thank you for being woke and seeing the connection. So thank you so much. I did want to finish this last portion before we go on break, and then we're going to come back and talk more about the facts. So thank you, Chris, and thank you, Stephanie. So this last part I just wanted to mention, you all, is this. We know how important mental health is. So after having focus groups for about 9 months, we put together what's called the California SCD Mental Health and Wellness Initiative. We're so thankful for that. And this was because our community health workers kept coming saying that people want mental health. Now, it's not like Medicare or one's insurance doesn't pay for it, but we wanted to find out why people weren't going and what would need to occur for you to get mental health counseling. So we were supposed to launch in June of last year, but we did it in April. And if you know me, you'll know that I'm very methodical. I have strategic plans about everything. And we launched this in April, even before I had money, but I knew that I would continue to write grants and get it funded. So what I can say to everyone here, please share and spread the news that we offer free to the community, adults with sickle cell disease. We offer to them free mental health, free health coaching, free naturopathic consultation. All they have to do is fill out the referral form and with their community health worker, and within 3 days, they'll be connected to someone. What I can say is when we started in April and to right now, oh my gosh, I think we're at almost 40 people. So here's the deal. Before we did this, people weren't doing anything. Now that we offered it and removed the barriers, the financial barriers, also what they said in the focus group that we did, they want therapists that look like them and that know about sickle cell disease. So we made sure that we have African-American therapists, and those therapists participate in-service training with us. So they may not be an expert, but they're willing to learn and continue to go get the training. As of March, and because of COVID, we're still doing things virtually. But as of March of this year, we can now offer children ages 9 through 17 mental health counseling. Harder to go beyond that because again, it is on the laptop, on the screen. And so any younger should be actually in person. And this is also available to caregivers as well. All you have to do is reside in California, and then share that with our community health worker, and you are connected. So we're really happy that we knew that this was a need, and we needed more than just supporting people by saying, yes, you should see a counselor, but they weren't doing it. And so now that we removed that barrier, as of April to now, we have about 40 people. And I'm delighted, but I also scratch my head like, so, but why is that? Why now? It's only because we made it easy to connect people and that they've been vetted with us. So I wanted to share.
I was just also going to say now is because our community has changed in its attitude towards, I think, services.
So I'm going to give you the summary first, and then we're going to go over everything, and then we're going to summarize again. So this is the fact-based portion of our talk on mental health and sickle cell disease. So, and there's a lot of literature regarding mental health and sickle cell disease, both for adults as well as children. On average, I think we already know this. So studies have found that there are higher rates of mental health issues in individuals diagnosed with sickle cell disease compared to the general population. So with respect to depression, anxiety, PTSD, and suicidal ideation, as we discussed, they tend to be very prevalent in this population. So that's a fact. Number two, unfortunately, most of that is because many persons with sickle cell disease face stigma and discrimination, mainly due to misconceptions and even providers who are not knowledgeable. And so we've already discussed that as well in terms of the discrimination that people face and being called outside of their name, like sickler and frequent flyer. This can lead to feelings of shame, isolation, and low self-esteem in individuals with sickle cell disease. Third, out of 6 facts, individuals with sickle cell disease, they do face barriers accessing mental health. And that was one of the things that I was sharing with you all. Why is that? On average, people do have some form of insurance, but I do know that some forms of insurance are inferior when it comes to accessing mental health. So these financial barriers can be significant, as individuals with sickle cell disease often face higher healthcare costs and may have limited access to insurance coverage. Additionally, logistical barriers such as transportation difficulties and lack of access to mental health providers make it challenging. One thing I did forget to mention is that with Cayenne Wellness Center, we do provide transportation via Uber Health. So if you need to get to the hospital for your clinic visit and or to the ER, just have to contact the community health worker, and that community health worker will actually schedule you a ride. Fourth fact, mental health care is an essential component of comprehensive care, and I think that everybody will agree with that. So there's different things that you have to do comprehensively throughout your lifespan. So whether it's as you get older, doing a breast exam, prostate exam, but also looking at one's kidneys. That's why they do CBCs all the time when you go in. So mental health care is just as important, and it's something that I think should just be routine. 5, untreated mental health issues can have serious consequences, and I think we already know that as well. PTSD can exacerbate the physical symptoms, particularly if you, because we know that if you're at home, you're attempting to manage. You've done all that you can to manage. So making that decision to go to the hospital is not an easy one. No one wants to do that. So when they do it, their whole psyche changes. They have to prepare themselves for that. So that PTSD, the depression, anxiety can also exacerbate and increase the risk of complications. And then last, it's important to sleep well. We already talked about nutrition, eat well, move well, breathe well, speak with someone, discover you and what you like, and enjoy and do more of it. All righty, so I'm going to take this time right now to go a little bit further into the facts. Feel free to raise your hands. I'm going to just check the chat from time to time. Okay, so someone's having technical difficulty. All righty. So
That's me.
who's me?
It's Nadina. That's me. I'm
Oh,
on my
okay.
husband's computer right now. This gray
Oh,
box up
okay.
here.
All
Yeah,
right.
that is me.
Okay. Well,
But yeah,
we can't have the host having problems like that.
thank you very much. I'm so sorry. I'm missing this. I am just so disturbed right now. But I just want to thank you all and just let you know that my heart goes out to everybody that's living with sickle cell, truly, having lost my son. So yes, let's move on.
All righty. So intro, I think we know what sickle cell disease is, but we don't know who's in the audience. So allow me to tell you, sickle cell disease is a genetic blood disorder that affects red blood cells and can cause various complications. And we know that, including chronic pain, organ damage, infections. Individuals with sickle cell disease experience mental health challenges as well as the physical, because of the emotional burden of the disease at a very early age. Nurse Pat, to coin her phrase, those of us with sickle cell are born into pain. And then it becomes, for many of us, having to manage how to navigate that pain. Mental health issues such as depression and anxiety and PTSD and suicide ideation are very prevalent, like we already talked about. So those are just kind of the intro that I wanted to just share. All righty, let's go on to the next page. All right, so the prevalence. So, and we talked about that there's quite a bit of literature out there looking at that. And there's actually literature too in terms of different forms of effective therapies as well. Cognitive behavioral therapy is one of the ones that tends to be effective, particularly if one's going through depression. So there's been many studies having found higher rates of mental health issues. And addressing mental health is essential because of this increased prevalence. I talked about how for Cayenne Wellness Center and the people that we've put in place and vetted, we do cognitive behavioral therapy for the first 15 sessions. And you do not have to have, I mean, if you need more than 15 sessions, that's fine. 15 sessions is considered short-term therapy. And then beyond that tends to be, quote, long-term. And you can move from short-term to long-term. There is no hard stop. All that means is that once you get into your 16th session and beyond, we put you in a different category just for data purposes. So, but we do, they're vetted to do cognitive behavioral therapy because it tends to be the most effective for people with who are experiencing depression and anxiety. So you'll see me going back and forth to checking the Okay. I don't see any hands raised, so we're going to continue.
Somebody said they didn't see the survey. Let me see if this is working.
And we can hear you, dear. All right, going to the next one. All right. My little ball is spinning. So I'm not able to go on to the next slide yet. Hold on. There we go. So let's talk about stigma and discrimination. It's something that we know occurs, something that we don't talk enough about. And I can share with you some of the things that we at Cayenne Wellness Center, what we're attempting to do with our initiative to manage this. So again, I think we already know by the nature of the fact that at least in the US, the majority of persons with sickle cell disease are people of color, mainly from African descent, followed by those who are Hispanic descent, and followed by that in terms of Native Americans as well. So we already know that there's stigma and discrimination is misunderstood, even though it's been around since the first paper written since 1910. It was found to be a molecular disease about 1949 by Linus Pauling. So you would think we've had more than enough time, 113 years, to figure it out. And yet the racism still remains, and that hasn't changed. But what I think people don't realize is the effect that it has on one's psyche. So it's one thing to live in a society that is racist. We just do. We don't always come in contact with it. But when you have a disease, unfortunately, that puts you in the hospital or the ER, you come in contact with it more than I think the average person that lives in such an environment, maybe the way that it was done back in the 40s and 50s and even 60s. So I think that's one of the things that we actually don't consider is one thing to be African American and just living in this world. It's another to consistently go back and continue to be discriminated. And I tell people, and don't let the person have tattoos, because I think then it makes it even worse. I think they get even worse treatment if they actually wind up having tattoos as well. So that actually has it has an interaction with respect to how people manage and how that interferes with and lends itself to depression, anxiety, and PTSD.
Yeah, so Chris had his hand up real quick,
Sure.
and then Adrian.
Sure, Chris.
As far as the mental health services, I know you said that you have them set up for the adults and then also the children, 9 to 17. In the case of, say for instance,
and caregivers as well.
Okay, that was my question.
My error for not putting it there, but yes, for caregivers as well. So we know that you may have a child that's 4 years old, but the caregiver needs services. That is there for the entire community. Caregivers, we even have someone who's, gosh, over 60, and the family is so affected right now by the decisions that this warrior is doing, that the family said, we need assistance. So the caregivers also can have mental health counseling, and it doesn't matter the age of your warrior. So that is available. Yes.
Thank you.
You're welcome. Adrian?
I just wanted to quickly say that right now, particularly with things the way they are in this country politically, it's even harder for us. And we are facing the stigma and the discrimination and the trauma because it's being delivered to us nightly in the news, right? It's there were times when we were growing up where there were communities that were all Black communities and all Black hospitals you could go to, and you had Black teachers, and your community was your community. And now that that's kind of gone away, we are facing more and more discrimination just as Black people. And when we go to the hospital, it is, to me, equivalent to kind of what happens if you go to the police. The police is supposed to protect you. That's their job. And yet we have all this trauma involved with interacting with them and knowing that they get away with doing terrible things to us. We have to go to the hospital. And when we're going to the hospital, it's for us a life-threatening situation, because we're told constantly that this disease can bring about bring about death. And so it's even more so, right, traumatizing for us when you're thinking, oh, it's my life or my loved one's life. And then if you think about it, how it treats us when we're going to get pain relief, when in fact they have everything they need to give us the relief of the pain right then and there, and then they're withholding it. So it feels like torture. And so all of this, again, as you said, feeds, this, I want to say, the one thing we're not talking about is what happens as a result of that is this anger at how unfair it all is.
Yeah. And I wanted to just say, so, and I think Chris mentioned it as well earlier. So that's why I mentioned the foundation first thing in the first part one, because I really believe that we can work towards prevention. But what I want to walk away by saying, there are times the nature of the disease, it can come on and you've done everything. And that is not to blame the person. But prevention is actually key to staying well, not having to go in and cycle through. But this stigma and discrimination part lends itself literally to cycling through back into the hospital. They accuse us of being a frequent flyer, but they're also feeding into it so that when you go and you're not believed and you're given 0.5 milligrams when you normally take 2 or 3 milligrams of Dilaudid, and you're having to suffer and it's extended, and then they discharge you prematurely, you will go back because you're not done. And so they feed all of this stigma and discrimination feeds into that. And I think one of the persons who we were advocating for felt less than human, felt that they were no longer a man. They were so tired, and we were convincing it just, for me, this was kind of a trauma too, to advocate. It brought me back to Bobby because the person no longer wanted to live. And because of what was happening. So
Yes.
Again, it has an effect on our psyche. And so, but I do believe that we should continue to focus on prevention.
That's right.
People can stay out of the hospital as long as possible. It may occur, and that's just the nature of the disease, but we can stay out as long as possible. And if we can do that, I think we can then begin to feel better. But mental health will really be
Right.
will really be helpful. Stephanie, you have your hand raised.
Yes, two quick things. One of the most frustrating kinds of discrimination comes when our own community CBOs groups make statements like, oh, well, they're not our kind of patient. When we are advocating for somebody, we had a patient who we tried to get this person help from a lot of different organizations and kept
Hmm.
hearing, oh, she's not our kind of patient. I mean, like she has sickle cell, she needs help. What's more to know? But anyway, that's that's one of the things that's extremely difficult to deal with as an advocate who also has the disease, because then you're wondering, well, what's different about her than me? Like, when are you going to pull that with me? If I call you and I'm in trouble, when are you going to say to me that I'm not your kind of patient? And then second thing is I found kind of a discrimination by company policy, that it's not really an intended discrimination, but when I would try to get my rides to my doctors in San Francisco, it would be such a stressful situation because partnerships people are all over the country. So when you book a ride, you don't know who you're talking to, and they are not all trained the same way.
Oh,
So
hold
it
on. Are
became a
you saying that
situation.
I'm sorry, dear, I had to interrupt so I can get
That's
clarity.
okay.
Are you saying that the person who's picking you up from Uber or Lyft, is that what you're saying?
When before I started using Cayenne, I
Mhm.
had to call partnership myself to book my rides, and those people that book
I see.
are the people that put the ride into the system are all over the country, and they're not trained the same way. So what ended up happening was I would be denied rides initially because, oh, you have to have 5 days notice. Well, no, if you look in my chart, you will see that this is an exemption because it's a specialist. Well, we weren't told that, and it would just create so much stress that I actually would be so traumatized when I had to call, that the trauma extended to my daughter who has her own mental health issues. So the fact that Cayenne and through Hope, Medina is the person who now does my ride, even if there's an issue, there's no issue because she's on it. It has been one of the most dramatic changes in my health care and mental health care that I can think of, right up there with getting off the narcotics and onto the Suboxone. It's major. I'm not stressed. I don't have to go through the anxiety. I don't have to end up making myself sick because I am so stressed about who's going to answer the call this time, and are they going to know what's going on, or do I have to educate them? And if so, and I have to educate them, are they receptive? Are they going to stick to, well, we haven't heard that? Sometimes you ask for a supervisor, there's not a supervisor on call. So the fact that I can get it through Hope is so amazing. It's so amazing. And I think that a lot of people would have much better health care if their CBOs were doing the same thing. That's something we really, I really am very, very passionate about, that other CBOs need to be doing the same thing because a lot of people are missing their health care for lack of rights.
So, Stephanie, I want to say first, thank you. And second,
Oh,
if,
thank you.
but seriously, if you could um, type that up, I know that we'll get the transcript of this, the recording, and if you don't mind, we could either type it up as well. We just need a testimonial because all of this is by writing grants and being able to support and pay for this. So if you wouldn't mind, I'd appreciate it. Thank you.
You want it in the chat?
Thank you. I'm going to move on to barriers to mental health. So we mentioned already before financial and insurance coverage not being the same. And so before we did the focus group, I not had a huge assumption, but I knew that, insurance companies are supposed to pay for mental health. What I found though is that for some, particularly through Medi-Cal or Medicare, that it's not as frequent. It's not once a week. And you may actually get a resident who's only there for 3 months or 4 months, and then you get someone else, so it's not continuous. So that's one of the things that I'm really happy that we do. The person that you receive, you'll have that person is not leaving, and that person will be with you for the 15 sessions or the plus 10, 20, 50 sessions beyond. And so that's one of the things that we did do in terms of managing that particular barrier. Other things as well, systemic barriers such as racism again, and bias. That's also another barrier to mental health. And as well in the focus group, we talked, many of the warriors, they were very adamant about having therapists that look like them. So that was kind of curious. I understand it, but I also needed to share with them and everyone here that as a psychologist, do you know that it's only 30% of us who are African American who are psychologists? Okay, so that's very few, and that's across the country. And so it became a challenge, but not an impossibility to be able to find. And so just understanding that I understand why, and we were very successful in vetting, gosh, not just one, but 3 agencies that have African American therapists. So we're very blessed. And so I'm very thankful for that. Other barriers that you all can actually think of, I mentioned the financial part, the bias part of sometimes of the therapist not having cultural competence. Any other barriers that you guys can actually think of as well?
I think there's the barriers in our culture for the stigma of needing, right, mental health care. To be able to say, I'm seeing a therapist, I need one. I mean, that's something I know I did at 19, and there was no way I could tell my family I was seeing a therapist, you know. And so I think that stigma is still there, and we have to work on that. And I also
admitting that you want and
right,
and how it's received.
And then the other thing that I see as a barrier, and Stephanie may be able to comment on this, is that when we are advocating and we say we would like to have someone come in and speak to the warrior who is hospitalized, what keeps turning up is a quote unquote psych review. And generally they're coming in from the standpoint of, well, we're evaluating you for your drug usage. And so just having to go through something like that, if you're in the hospital instead and you say, I'm really stressed, I would like to have somebody to talk to, then they order a psych review, and you think that there's going to be a counseling session when they come in, and it's actually, I don't even know what you want to call it, but generally it's more like a drug screening thing, because that's what the hospitals are doing. So we encourage people to ask to see a clergy person so that they can have some support, somebody to talk to while they're there. But I think it is also part of these barriers, this idea of a barrier. People don't want to say, I'm seeing someone.
Right.
Because it's become part of the DEA's war against opioids, right? So, yeah.
I do agree. I've had that happen both personally on more than one occasion where I was in hospital and specifically requested to talk to somebody. And like she said, it was made either an issue of, oh, well, we're going to make this a drug evaluation,
Yeah.
or I was actually threatened that
Mm-hmm.
if you don't do what we want you to do, we will send psych in, and we won't be able to give you your pain medicine
Right.
because psych
Weaponized.
is yes, they were weaponized. And as an advocate, we have seen countless times, and it's not even just that they weaponize it and a person is asking for help and they tell them that they're going to do this as we had it come up in a patient that what they actually did was they did order the site person, but they also drew blood work, and the request was weapons of drugs of abuse. And it listed a whole bunch of them, and all of them came back negative. And yet, when the site came in, they still were pushing that narrative. Well, after that was all cleared up, the person disappeared out of the records, and she could no longer have access to site. So there's all of this very strange manipulation of a patient that makes you feel like just saying the word out loud is going to come back to haunt you. And nobody's getting help. So even the people that are trying to reach out have to go through their clergy, and clergy aren't always experts on the illness that we have. Not that all psychiatrists are either, but at least they have some more training than the clergy on the medical issues.
Yes.
So it's beginning to be a very, very scary um, place. And if you are an advocate, I think that I don't talk to my therapist about my advocacy work because they kind of glass over in their eyes. So advocates need people that work in their foundations that are psych people that know what the foundation does and know about how we advocate.
Thank you.
I just want to add to what Adrian had said about, our own mental health and that stigma, because we grew up learning or being taught that, you're okay, I'm okay, and it's okay. But it's just like, having sickle cell. And my son never wanted to tell anyone he had sickle cell, and I think that we're so conditioned to, I don't need therapy, or I don't want to tell anyone I'm seeking therapy. And I think we get caught up into that too deeply, so that we don't share it, and we may not even pursue it, even though we do need mental health assistance. We can't recognize it because we weren't conditioned to think that way, or to seek out counseling if you are having difficulties in processing. It's like, oh no, I got this. I don't need nobody telling me, and I don't want to tell nobody my business, right?
Right.
So I think that, we've been conditioned to think that way, and it's time for us to open up and let it go, and I told my son that on numerous occasions, because it's just like you said earlier, what happens? What do you tell him if you're not at work for an entire week or so? Ultimately, it's come to the light. So you have to feel comfortable enough to share it and hope that people understand it. And if they don't, well, they just don't. And that's going to happen. And you have to be prepared for that. So, yeah, I just wanted to add that. And I'm still the gray person and I'm the person in that gray block. I'm the host or the co-host, but right. Yeah, I wanted to share.
That's why I said, as of today, oh my gosh, we have 40 people participating. And I wonder about those 40 people prior to April.
Yeah.
And I know that there's about 5 more that we're processing. So I hear what you're saying. And I think as long as we make it available and we tear down the barriers, they're going to
yeah, it's going to grow.
Absolutely. Absolutely. And I'm glad you got the 40 you got, but I'm just thinking about, there are so many people, right? 40 is good. It's just so minute in my mind, because we got a lot of loonies running around. I'm sorry.
I'm sorry, but that's pretty good.
That is good. I just have one more thing. I did put it in the chat. and that is also the barrier, because it is a barrier, is that we're being pushed pills. So you come in and you say, I'm depressed, and they go, okay, I'm going to put you on this. You say, I have anxiety. They're, oh, well, I'm going to put you on that. And so it's like, and it's bombarded. I mean, we see it, all these commercials on TV that tell us we're going to have a happy life or better life, but the docs are also writing the scripts. And then a lot of times they're writing the scripts and they're not looking at what other meds you're on. So those meds altogether can cause even more depression. So I think when we talk about barriers, that we also need to make sure that we mention the fact that, you know, people are being offered, it's
drugs.
Not only offered drugs as opposed to therapy. And
that's why. And then they got the nerve to call us drug seekers. Excuse me. They're the ones that are writing these
exactly the point.
Right.
They're not taking a look at how their actions of writing pills for everything else is commonplace, and you don't call the patients who are getting, you know, stuff for high blood pressure and diabetes and this, that, and the other thing, and depression and all of that. They don't look at how their actions in doing that are normalized and how much more discriminatory it is when they talk about we're drug seekers. How do we get them to realize that they need to look at drug writing behavior in its entirety and the effect that it has on society? I think I have a more of a sociological brain. So when I look at a problem, it's from that standpoint, and that's what I see. They're so quick to write drugs for everything else, but don't understand how that makes patients feel who have sickle cell when you come to us and you're like, oh no, we're gonna give you a 0.5 milligram of Dilaudid when you're used to getting whatever 4 milligrams. Like, you write everything for everybody else.
Right. So this is why I wanted to say, so this is where we happen to live in the US. And so there's a particular model that on average, most US physicians follow, and it is not holistic. And it is based upon symptoms. You say a symptom, I have something to treat the symptom. So I think part of the education has to go towards, which we all do, SCAASF and Cayenne and Access, to educate the families and the warriors in a holistic fashion. So we happen to live here. Other societies, they do have a more Eastern approach, more holistic approach, and everything is not about symptoms. And so again, I'm going to go back to prevention, and that if we look at the foundation that I mentioned, and moving, breathing, nutrition, that we may be able to manage. However, some persons do have complications that are irreversible. And so with that, because there's a time and place for everything, and there's a time for Western medicine. And so with that, that person might be on red blood cell exchange or what have you. So we're all, as Dr. Wanda Witten-Sherney would say, we're all these snowflakes, very different, with the same type of disease, but a different manifestation of it. But I think we should get more towards prevention. And when you do that, you're approaching your whole body differently than accepting them to just continue to give you pills. So they continue to give it to you, and then you wind up being on 15 different pills. So then you had to take a pill holiday and then go back and figure out, okay, where did we go wrong? So prevention is the key. And even for mental health, there's a time and a place. So talk therapy, very successful. Unfortunately, for some people, they actually may need psych meds, and that just depends upon their diagnosis. Looking at our time, and
Carolyn, if I could add just real, I know we're short on time, but I just also wanted to add, I think the part of the CBOs, at least what we do and what you do, Dr. Rowley, is important to know, like, if you go in there as a self-advocate as well, as Dr. Carolyn mentioned, like if you're doing all those holistic things and you follow up on the research yourself and whatever little parts that you can understand also kind of helps with that approach to the doctors, because as Dr. Rowley mentioned, they're just looking at a sheet because sadly they're also oversaturated. They might be seeing 1,000 patients when they only really need to be seeing 300, but because of our system and everything, how it works, they're also, and I'm not giving excuses at all. They should be doing better because they should care about the patient and not their careers. But overall, you do have to also understand circumstances from all areas. So with that, being a self-advocate and being aware of what you're going through yourself and being educated is very critical. I know my mom personally, she had a heart attack about 6 years ago, and we found a great cardiologist at Stanford. But I think what made it work well with him, and he even said it himself, was that I myself, being a biologist background, I did the work to figure out like what's really wrong with my mom and what can we do differently. So luckily she's not on that many medications. He agrees with us, like she shouldn't be on that many medications, walking, jogging, Pilates, working out, eating right, all those things. We've kind of come to a good understanding of what we can be doing, but that's only because we advocated and we talked about like, hey, we really don't want her to be on these many medications. What can we do different? And that also puts it on the doctor to do their research and be better caregiver to you. Part of it is also holding people accountable, and I think that is a way that we could really do that. So definitely all the information we can get from these AEPs, yourself doing the work, but don't be afraid, because remember, the one thing I always tell everybody, nobody knows your body better than you. Even he may have graduated from Harvard, wherever he graduated from, he or she, they don't know you the way you know you. So always remember, you can be an advocate
You
for
living
yourself.
in that skin.
thank you. I just have 2 more slides, this one and number 6, then we'll open it up. So the importance of mental health care for individuals with sickle cell disease, I think we all know, and that untreated mental health issues can have serious consequences. Again, depression that goes undiagnosed, anxiety, PTSD, we already said it, it can exacerbate the physical symptoms. And then also, like we just said, addressing mental health issues requires a holistic approach and not a Western medicine approach. So let's move on to the last one. And so I'm summarizing. Like I mentioned, we're going to go back to where we started. Again, just that there are higher rates. We do face stigma and discrimination. So a lot of that has to do with as well, educating the providers. I actually meant to say one thing as well. So at our summit, which I hope that all of you will be able to attend in September 13th through 16th in Torrance, Southern Cal. I'm excited because finally, during the physician track, we have, and we offer CME, we have implicit bias training delivered by World Trust, who's highly known for their implicit bias training. And so we're offering that any physician who takes that on Saturday and they do the implicit bias, that we will pay for free. They don't have to pay. So in other words, if they only do Thursday and Friday, they're gonna have to pay. But if they do Thursday, Friday, and Saturday, we're going to say, we'll give it to you for free. That's how much we want the physicians to be in the room for the implicit bias, because we really want them to understand how it works and how what they're doing, how it actually changes the game. So I wanted to mention that. Number 3, we talked about how people with sickle cell disease face many barriers in accessing mental health. We talked about that. going back again, that it's an essential component of a comprehensive care. Untreated can have serious consequences. And again, we're sleep well, eat well, move well, breathe well, talk with someone, please. Discover you, who you are, what you like and enjoy, and do more of it. And we are here to assist you. You matter. You are important. We are now open for discussion, and I'll bring this back again to share with you our contact information, but I'm going to stop sharing for right now. Ah, okay. So Adrian writes, yeah, and that, we had that talk last year during a mental health mini seminar. Adrian says it took 5 different therapists before I found the right one. That actually happens. You have a choice, and you don't have to stay stuck with that person.
I also wanted to say, and over my lifetime, I had to have several different types depending on where I was of therapy. So I had talk therapy, then I had the kind of like where you analyze everything. And then it just got to where I just need to be a behavioral therapist. I just need you to give me some clues so I can change this behavior because my head is somehow lacking. So just give me some behavior. So there are different types of therapy, and you will, depending on what it is that you're dealing with, ultimately they all change behaviors. I have to say that, but there are different types, and yeah, you just move on. Within like sometimes just the first visit, but sometimes it might take you 2 or 3 visits. But don't feel bad. It just doesn't work.
Yeah.
And there's also, as a life coach, I can also give a quick shout out to life coaches. That's another form. It's not necessarily all mental health, but we definitely recommend that you go see a psychologist or a mental health expert before you go see a life coach. But as Adrian mentioned, it may not even be in that psychological realm. You may just need someone to just hold you accountable to certain goals, or maybe figure out what your goals in life could be. Maybe something's not working right. So definitely life coaching could also be a form that you look for that could be therapeutic in a sense, but more like, as Adrian just mentioned, just someone that just gets you in gear and just like, let's get this done, and hopefully it brings positivity to the floor. And same with therapy. You got to find the right life coach, and you got to find the right niche that you're looking for. So if you have any questions on that, feel free to ask me as well. So.
All right, the floor is open. Chris.
Hey, Dr. Rowley, I wanted to read a few lines about some data and just get your point of view on it. It says that the current ratio of sickle cell anemia to sickle cell trait is 1 in 50 for African Americans and less than 1 in 1,000 for tropical Africans. This etiological disparity is attributed to the anti-sickling agent thiocyanate found abundantly in staple African foods. American staple foods have negligible sickle cell nutrients.
So let's talk about the facts first. And I'm not sure, I didn't catch it because I thought it was odd. In Africa, there are millions of people with sickle cell disease and trait. But what I heard you say is in terms of, so I want to make sure, you said it was 1 to 50 in the US, correct?
Yes.
And 1 to how much in Africa?
1 to 1,000 for tropical Africans.
So I would actually think that it would be the reverse, because there seems to be more people in Africa. There's millions of people with sickle cell disease and trait versus in the US. So it's 1 in 365 with persons who have sickle cell disease here. So that was the first thing that caught my brain, was it seemed that it would be reverse actually, since there's more.
No.
The second part having to do with the food, I would agree. I think that personally, I am plant-based. I actually prepare everything. Everyone knows that I actually don't go out to eat, and I prepare my own food. And even that, which is all organic, might be troublesome too, just because of the earth and how we just kind of toiled and overused our earth and the dirt in it. So even though it's organic, and I do that on purpose, get the organic, even people can get whole foods, it still might be troubling just because of the amount of time that it's been toiled over. So I wouldn't be surprised that there was less of those anti-sickling properties in the foods that we eat here. Only because, as I mentioned at the beginning of the nutrition part, 85 to 90% of persons who eat, they eat ultra processed foods. It's no longer just processed foods. They're eating ultra processed foods. So I'm going to share with everybody real quick, what is ultra ultra processed food? So I'm going to share, I actually wrote it down. Give me a moment if I can find it quickly. Yep, here it is. So ultra processed food. So an example would be the bread that you eat. So unless it's homemade bread, margarine was one of the first mass-produced ultra processed foods as a way of turning waste oils into an edible product. So basically it's a fake butter. So synthetic foods, almost all commercially available breakfast cereals are ultra processed. Almost all supermarket breads are ultra processed. Almost all yogurt, plain and flavored, are ultra processed. Condiments for your sandwich and things like that are, and the list goes on. So I wouldn't be surprised. That's just where we're at. And I did mention there's a book out, Ultra Processed People. And I think for me, it's not to scare people, but my only thing is, please read labels, please be conscious. I know that it tends to be less expensive and then you have to take more time to prepare. But when you're eating ultra processed food, you wind up eating more because that's what it's intended for, you to eat more, spend more, and then feel bad. And that's the whole purpose. So again, since we're on nutrition, just become more mindful of what you put in. And even if you can change one of your 3 meals, maybe one of those meals could be a non-ultra processed meal as you look into that. I'm not sure if I actually addressed your question, but from what I understood, that's my response.
Yeah, you did. I just had one more follow-up question, and it's about the relationship between the decline of Black farmers and where we are here with sickle cell. If you could just give some insight on, what you think about that, and maybe even how some of the decline around the Black farmers have created food insecurity or food deserts within the Black community, and how that's worked towards exacerbating sickle cell.
Well, so what I can say is I'm very much into supporting Black farmers. What the president of the Black Farming Association says, we need to, at all possible, let's start buying more farmland in the Central California area. Just buy it up, because what's happening is there's less and less Black farmers, and so they're trying to let us know, we as a people, let's just kind of start buying up the land. It's not as expensive as if it was having a house on it. We should just do that. But I don't know if I can put it on the fact that there's less Black farmers that has a result, a consequence regarding food instability. I think that Monsanto and everybody else, they're trying to buy up because ultra processed foods make money. So I can't say that it's because of Black farmers, but I think that whether they're a Black farmer or a farmer that doesn't have as much melanin, if they're wanting to provide real food and whole food, and we continue to support them, I think in essence, then we wouldn't have food instability. But we have to be careful to make sure that we don't allow these big corporations to start buying up the land. That's what's actually going into food instability, because if they're doing that, that actually feeds into ultra processed foods. So there's a relation regarding that. And I've shared this before. We should just be buying more land in Central California and holding on to that and maybe leasing it out to the Black farmers. But that's what's actually happening, in my opinion.
Thank you, Doctor.
And Stephanie?
I just wanted, it's not about food actually, but there was something that Ms. Adrian said in the chat that I don't think we touched on. And she said that it's hard, I'm paraphrasing because now I can't find it, but she said that it's really hard when our loved ones, it's hard for us to accept when our loved ones are done. The best we can do is to offer support and gather more resources for supporting each other. I knew a woman, and I know a lot of sickle cell patients, we speak about this as being an issue. I knew a woman who had sickle cell, and she had kidney dialysis and peritoneal dialysis. She was going to have to move from Los Angeles 2 counties away with her daughter to someplace she'd never been and live with her daughter there. She chose to go off of all of her dialysis and basically end her life rather than deal with having to go through the re-education of a new team of doctors and physicians. And I have this discussion with my daughters all the time because they see how crazy it is at our hospitals, and they don't really understand that a lot of stuff is the same, and that the trauma of re-educating a whole nother team of doctors is just almost unthinkable. And I don't think it's something we talk about enough
Right.
in mental health situations, but I I don't know how to change that problem, but that is something that we definitely need to talk more about, because a lot of people, especially when you're older, don't want to have to do that. It's
Well, Stephanie, let me say
scary.
this. So I'm going to tie that into fatigue. You hear, I think Adrian said it in the story, she was tired. That doesn't always mean fatigue.
Right.
It could be mental fatigue. Bobby was tired. People are tired, and they use that term as if they don't have any more energy, will to continue. So fatigue is discussed. There is actually quite a bit of literature. And so I do hear what you're saying. Make a person making a choice that has to do with their life, not realizing the impact that it has on those that are remaining. So suicide, we need to talk about it more. We did talk about it in December last year. It was excellent. We'll be doing a part 2 this year in December. It's real. And for those who've not experienced being close to someone who's actually made that decision, it's hard for them to understand. But when a person has made up their mind, there really isn't as much you can do except to continue to be supportive. And I feel I was very, very supportive of Bobby. I actually continue to visit twice a week, 1.5 hours each way, because I cared and I loved him. And I know that I showed him that. And so the person made up their mind, and that's what suicide is, that for the most part, people want help. That's why they don't do it. But people who actually complete it in various ways, they've already resigned the fact that this is what I'm going to do, whether it's slow or immediate. And so then the loved ones are left to have to manage that and those emotions. So I think that we just need to hear and to listen. I always say, let's listen and listen some more. When people use the words, I'm tired, I'm done, that's serious. And don't be afraid to ask. That's the other thing in our community. So in our community, first of all, we don't talk about mental health. And secondly, do we actually ask people, are you wanting to kill yourself? Can't be afraid to just ask. I know that we have this discussion with our staff, and they were like, should we be so harsh? Yes. I used to do suicide prevention therapy for 8 years. I was on the Suicide Prevention Center hotline for 8 years. You have to ask. You're not going to put it in their brain. And when you ask, sometimes that's a relief for that person. And it gives you a way to start discussing, let's talk about it. What can we do? How can we support? So I hear what you're saying. Part of it is cultural. And but I think because I've been doing this for a long time, I'm not afraid to ask. I'm doing my job. And I'm asking you, how do you feel? Have you thought about killing yourself? I use the words. I hear that you're saying that you're tired and it's just too much. What can we do? And the thing about it is, here's the time to be afraid. When you see them and they finally feel like everything's going okay, that's the time to actually be concerned. Because when you resigned to that thought, it's almost as if it's a release and they're done. So that's the time to be concerned. When they're still talking, don't be afraid to ask. But yes, all that we can do, letting the person know that that there's resources. All you can do is share. But remember, they also have a brain. They also have a life, and they've also made the decision. And all we could do is attempt to, but not feel guilty or bad if that is their.
What was sad about her specific situation was hers was specifically tied to the fact if she could have stayed in Los Angeles,
But she made a decision,
she could
huh?
have found a way to stay in Los Angeles and not have to retrain a whole team. It's the issue of that we're not talking about is the issue of those of us who have a comfortable enough relationship with our doctors, and even if they're not so comfortable, there is a part of that tiredness that is specifically directed at having. I've been here where I am now for almost 12 years in this city. We have 3 hospitals. I've always been at this one particular hospital. For me to now switch and go to another hospital, I'd rather go back to LA where I still have connections with the team that knows who I am and what my issues are than to have to go to another hospital in this city and becoming unknown and just be seen as a sickle cell patient in a predominantly white city that they don't know anything about sickle cell. It's a I think it's a subsection of the tiredness. It's a very specific subsection.
Well, I'm just going to bounce in here and say what we are hoping to do here, or pilot here in California, is between the point of care advocates and our community health workers and our CBOs, is to help anyone who is in that situation, so that we can have a plan if you know there's going to have to be a change where you're not having to do all the outreach and the education and everything on your own. Because you're right about the exhaustion that comes right? When you think about it, a normal hemoglobin for normal functioning female is what, between 12 and 15. Pat's the nurse, so she would know. So let's say you're at a, we'll give you a fairly high one. So you're at a 9, right? So just getting up, moving around, moving a body around, you're not going to have the energy, the oxygen to do that. And then you pile on top of it the meds and everything else we've talked to. So then having to go and do that heavy lift all on your own is really hard. So again, looking at what things that we can do, what are we trying to put into place to help carry that with you? And so therefore leaving your reserves for things that maybe only you can do. Does that make sense?
Yes, that's an excellent idea.
Because this is what I mean by support. So sometimes, as you know, when we've been advocating for someone whose family has dropped away, then they find out there's advocates, then those family members suddenly have a breather and regroup and can step back in when they can. So again, this is a similar kind of thing. So I guess we'll have to talk about this more, but absolutely here in California, that is what we're putting into place.
Okay.
Thank you.
Yes, thank you. That was a great discussion, guys. I'll let Carolyn finish up with a few words in a second. We just have to cut it off because we have reached the time limit, sadly. I wish we could do this all day, but you know, other people do have other things to do, and also we can't be here for 24 hours. Although, I mean, that's how long it would take to have a really good discussion. But anyway, go ahead, Dr. Rowley, with your closing remarks, and then I will finish it off and we'll conclude.
Okay. Thank you.
I think we had a really good discussion.
Yeah, yes, I think we did too. And I just want to thank Adrienne and Carolyn for your time and all of your energy and information. It was so valuable and so necessary. I'm just saddened that there weren't more people on to hear it. We did, 25 people, registered. However, we didn't have all 25, but maybe they'll catch it on the recording.
Exactly. That's how I look at it. So
Yeah.
everyone, if you want to be able to contact us anytime, I think as you get to know me, I respond even at 3, 4, 5 in the morning. So this is the phone number, our website, and our email address.